Welcome. My name is Jay Otto, and I'm a researcher with the Center for Health and Safety Culture at Montana State University. Our center conducts research to understand how culture impacts health and safety. Most of our projects focus on substance abuse, traffic safety, and issues regarding violence. We work with organizations and agencies at the federal, state, and community level across the country. We've been very excited to work for the past several years with the Oregon Health Authority on a project to address underage drinking. During this webinar, I'm going to provide a brief overview of the positive culture framework and introduce a powerful resource communities can use to reduce underage drinking among their youth. First, let's briefly touch on why addressing underage drinking is so important. In 2010, there were over 170,000 underage drinking episodes each month among Oregon high school students. We know that underage drinking contributes to unwanted pregnancies, sexual assaults, violence, property damage, poor academic performance, and in some cases the use of other drugs, and in the most severe cases can lead to addiction. It was estimated in 2010 that the cost of underage drinking in Oregon was $700 million. Now, after reviewing those statistics, one could easily become discouraged. However, our center always operates with the core assumption that the positive exists and is worth growing. And we know that this is true in Oregon as well as we address this issue of underage drinking. So let's take a moment and put a little science behind our understanding of underage drinking. Underage drinking is an intentional behavior, and a very simple behavior model like the one on the screen can help us understand how to predict intentional behaviors. Values, attitudes, and beliefs, and a willingness and intention all precede engagement in such a behavior. Therefore, as we seek to change underage drinking, our work is really about connecting to existing values and changing attitudes and beliefs. This helps us realize and focus our efforts, so it's not just about getting kids not to drink. The focus is really on how do we shift attitudes and beliefs that then result in less underage drinking. Now, a critical question that we must ask is, where do these beliefs come from? Now, clearly there are many contributors to an individual's attitudes and beliefs. Their own personal experiences, what they've learned in their family and from their peers, what they learn at school, what other agencies and organizations throughout their community teach them. In essence, we can think of their attitudes and beliefs really come from their culture. At the center, we use a very simple definition of culture. We define it as the shared values, beliefs, and attitudes and behaviors of a group of people. The critical aspect of this definition is the word shared. It's not that everybody holds these, but it's that most people do. And it's from these shared values, beliefs, and attitudes and behaviors that we seek to grow improved health and safety. If we can grow the beliefs and attitudes that reduce underage drinking and make that a part of the culture, we can therefore sustain our results. It's also important to realize that different groups have different cultures. So, a school can have a culture, a class within a school can have a culture, a community can have a culture, a state can have a culture. An organization or agency like law enforcement or alcohol retailers all have a culture. So in fact, our communities are made up of many subcultures. And of course, they have overlapping values, beliefs, and attitudes and behaviors, but they also have unique ones as well. And part of our work will be to understand those different subcultures and to see how we can connect them together around some shared values, beliefs, and attitudes to address this issue of underage drinking. Now, we can also understand how individuals develop their attitudes and beliefs by use of what's called the social ecology or the social ecological model. This model recognizes that individuals are influenced by nested layers of relationships. So clearly, families and peers influence our attitudes and beliefs, as do our schools and workplaces and our community. In this way, we can operationalize the idea of community and look at each of these individual layers. And in fact, each one of these layers can contribute to reducing underage drinking. And it's truly when we see it from this layered approach that we can really begin to tackle the culture that surrounds underage drinking. And as we improve that, sustain our outcomes, because improved health and safety just becomes a part of who we are and what we do across our community, across these layers of the social ecology, and are therefore embedded in our culture. Thinking about addressing underage drinking from a social ecological perspective really transforms our approach. Before, we might have looked at the issue of reducing underage drinking as, how do I get youth not to drink? In other words, what do I need to do to youth, the individual in our social ecological model, to get them not to drink? But if we take an ecological approach, now we want to say, what actions do I want to grow across the social ecology to reduce underage drinking? We always say in these very complex issues, there's no silver bullet, but there is silver buckshot. Multiple strategies delivered across the social ecology, all coming together to thereby have a profound impact on the behavior. At the center, we use an approach called the positive culture framework to achieve this transformation. The positive culture framework builds on our previous ideas around growing positive community norms, but really takes things to the next level. On the right side of this figure is the green arrow. This documents what we're trying to grow. It very intentionally is designed as a green arrow. In other words, our focus is to seek what we're trying to grow, not just eliminate. At the top of that, our ultimate outcome is to improve health and safety. In order to do that, we're going to need to increase protective behaviors and decrease risky behaviors across the social ecology. So the work is not just addressing high school students when we try to reduce underage drinking, but the behaviors of all of the players across the social ecology. And we will do that by changing the cultural factors, that is, the shared values, attitudes, and beliefs that influence those behaviors. So our work is really about changing shared values, attitudes, and beliefs, because this will lead to behavior change and ultimately to improved health and safety. Now, how do we do that? Well, on the left-hand side, we lay out a 7-step process that leads us through basically a strategic transformation approach. It begins with our planning and advocacy work. We then seek to understand or listen to or assess the current culture, so we understand where things are now and where we have opportunities to build and grow the positive. Next, we seek to establish a common purpose to align our effort and prioritize our opportunities, because we can't do all of the work at the same time. Next, we develop a portfolio of strategies to address it. This is where we recognize there's no single approach or silver bullet that's going to reduce underage drinking. It's going to be a whole portfolio of strategies, or silver buckshot, multiple strategies across the social ecology. We'll then pilot and refine these strategies as we adapt them to our local communities. We'll then implement them on a broader scale so that they really reach everyone. And then, of course, we will want to evaluate to learn what we've done, what worked, what didn't, and what we need to do differently, and to better understand our needs. Our process is very intentionally laid out as a circle. Because the cycle is repeated, we will never be done improving the health and safety of our communities. We can always do better. And around this circle is the recognition that we need to develop 3 core skills: leadership, communication, and integration. In this project, we provided tools to help the communication skills of local prevention providers. However, they also need to work on their leadership and integration skills. And at the center of the circle is the social ecology. This is where we do the work. Addressing underage drinking is not just about focusing on underage youth. We must also address their families, schools and workplaces, and the community at large. Now, for an issue like underage drinking, there are many actions we seek to grow across the social ecology. Among parents and families, we want them to establish clear expectations and rules about underage drinking, and enforce those rules, as well as engage in good monitoring practices. For schools, we want them to engage in evidence-based curricula so students understand what alcohol does to their bodies from a very strong health perspective. We also want them to establish strong policies that show that they don't tolerate underage drinking and have policies in place that they provide interventions as needed for youth who have experimented. For healthcare providers, we want them to engage in screening. They can ask patients and understand if additional efforts need to be taken with students who may require an intervention. In addition, they can provide very valuable patient education. For alcohol retailers, we want them to train their employees to identify underage buyers and to not provide. And for law enforcement, we want them to engage in consistent and visible enforcement to show the community that we have laws about these issues and that we take these laws very seriously, as well as conducting source investigations when an underage drinking party does occur so that they can identify how the alcohol ended up with the youth and who's responsible. Together, these actions will be most effective at reducing underage drinking in our communities. And when we all engage in these actions, these become a part of our culture and just becomes a part of who we are and what we do. Now, a tremendous challenge with culture is that it's often misperceived. But what matters are our perceptions. If youth think most of their peers drink, then that's the world they live in, whether it's accurate or not. So it's very important for us to understand not only what individuals are doing, but also how they perceive their culture, because their perception will start to influence their beliefs and attitudes, and ultimately their behaviors. For example, in a survey of Oregon youth, 81% of 11th graders reported not having 5 or more drinks in a row in the past 30 days. 5 or more drinks in a row is considered binge drinking or drinking to get drunk, and a very dangerous behavior. So we're absolutely concerned about the 19% of students who are engaging in this behavior. Thus, this is why we're doing the work, but we're pleased to see that most students don't engage in this behavior. However, when we asked those same students what they thought most students in their school were doing, 71% thought most had engaged in this high-risk behavior. So we're very concerned about, as we think about peer pressure and expectations, that these students are misperceiving what their peers are doing. In fact, students who misperceived monthly drinking among their peers were 6 times more likely to drink monthly themselves. And if they misperceived binge drinking, they were 9 times more likely to binge drink. So we're very concerned about those students who are misperceiving these norms and want to establish what the accurate behaviors and, in essence, culture of underage drinking is among Oregon youth. So for this project, we seek to develop and grow protective behaviors among a wide variety of key players across the social ecology. For this project, we've developed toolkits to help local prevention providers communicate with each one of these different layers. Each toolkit provides research background, behaviors to grow, results from surveys to help us understand what these people are doing and also how they perceive their culture, as well as communication tools to start to shift their beliefs and grow protective behaviors. All of these communication tools are aligned around a common theme, mORe. It's the recognition that more youth are choosing not to drink, and all of us can do more to reduce underage drinking in Oregon. For example, for our adult toolkit, a survey revealed that most Oregon adults have strong protective beliefs about underage drinking. In fact, almost 3/4 agreed that they disapprove of youth under the age of 21 drinking alcohol. This is a very strong, positive element of the culture that we want to leverage in terms of doing our work. However, almost 1/3 did not believe that most other adults felt the same way. So we have people misperceiving what the culture is among Oregon adults on this issue. And we want to make sure we clarify that and build on this positive, strong foundation. Furthermore, most adults supported parent protective behaviors, school engagement, and local law enforcement of underage drinking laws. These are all very important behaviors of other players across the social ecology that we want to reinforce. However, support for these were also misperceived. So we'll want to emphasize that people in Oregon support these protective behaviors across the social ecology. And many Oregon adults drastically overestimated drinking among 11th graders. In fact, 8 out of 10 of adults believe that most 11th graders in their community drink 3 or more times per month. And half of the adults believe that most were drinking 10 or more times per month, when in fact, 2/3 of Oregon 11th graders don't drink at all in a month. Now, we're very concerned about the 1/3 who are, but we're really misperceiving what our culture is, and in fact, could reinforce negative behaviors when in fact we want to reinforce the positive behaviors that most students are engaging in. So for adults, our core messages are that most Oregon adults disapprove of underage drinking. We want to establish this throughout the community and all layers of the social ecology. And in fact, that most Oregon adults agree that parents should not let their underage children drink alcohol. This is a very important protective behavior that parents can engage in and will absolutely reduce underage drinking. We also want everyone to realize that more Oregon teens are choosing not to drink, that in fact, underage drinking is going down in Oregon, and we need to continue and keep up the good work so it continues to be reduced. Media to reinforce these messages have included print items as well as web banners for placement on the internet. We've also developed radio and television ads that can be distributed in a wide variety of ways. All of these messages seek to reinforce the core beliefs we want to grow among adults in Oregon. The Center has developed toolkits for each one of these key players across the social ecology. These tools will help community prevention leaders grow the critical beliefs and attitudes in order to grow protective behaviors and reduce underage drinking in our communities. In this way, we can transform our culture and make improved health and safety a part of who we are and what we do. In this way, we recognize the solutions are in the community. By each layer engaging in appropriate protective behaviors, we can effectively reduce underage drinking in our communities. In this way, the solutions to address this challenge come from the community and its own values, attitudes, beliefs, and behaviors. In other words, it's our community's culture which is going to allow us to reduce and sustain lower levels of underage drinking. To learn more about the Oregon mORe project, visit its website at oregonmore.org. To learn more about our work at the Center, please visit our website at chsculture.org.